And good morning to you. You know, you got that little jungle juice or whatever got you going this morning, and you have your little coffee and your little bowl of cornflakes and whatever cereal, your banana, yeah, with a little sugar. You know. Good morning, Cassandra.
Good morning.
Did you get your banana with a little
nutty,
sugar and
the nutty
and fruit in
flavor,
that?
the nutty flavor from Sunshine Cereals.
Okay, wonderful, wonderful. So you ready to go?
Yeah, all set and ready to go. Good morning to you. I hope you're all set and ready to go. Always good to see you.
Well, it's good to see Dr. Andrew Ford, our dermatologist, who joins us.
Good morning.
Did you get your little get up and go?
Yes, I did.
What do you do in the morning when you get up? What gets you going?
Well, actually, I'm kind of unorthodox. What I do is I take branched chain amino acid tablets and glutamine and some other things that bodybuilding and fitness people would take.
Oh.
I'm unorthodox. Yeah.
Oh, so your workout comes when? At what part of the day?
Usually it's in the morning, around 5 o'clock.
Except for when we disturb it.
Yeah.
Manic Mondays. You know how it is. Always good to see you, though. You have an interesting topic that we're going to discuss today, and it is Lichen Planus and Lichen Striatus.
Yes, that's correct, though.
Now, I have an idea what Lichen Planus is, and it is a rash of the skin,
Yes.
usually found in the mouth or on the hands, I believe it is.
Dr.
Dr. Doug.
You understand?
I did a little reading.
Research.
Yeah.
Yes, we've been doing a number of conditions called papillosquamous eruptions, which are conditions which give you little bumps and also flat, roundish areas. And in continuation with that, we're doing lichen planus today, which is an itchy inflammation of the skin that tends to affect the mucous membranes, which can be the mouth, the genital tract, and also the skin.
Okay, this is not very pleasant to look at. We do have some photos, so we just want to forewarn you that we will be sharing the photos. Carry on, Dr. Ford.
Yes, lichen planus is very itchy, as I said, and classically it occurs on the lower part of the limbs, like the wrists and also on the legs. But as I mentioned, it can occur in other places and also on the entire body. If you are uncomfortable, if you are unlikely enough to get it, then that can happen. It occurs and lasts for about 2 years sometimes, and the most important thing is that sometimes it leaves some very unsightly discolorations after, which take a while to go away. But it can affect the hair follicles. It can appear in circular forms, in bumpy forms, and very thick forms. And you see some pictures there. That's a picture of a young lady who had a tattoo. And lichen planus tends to display something called the Koebner phenomenon, where if you get a trauma, a scratch or a blow or a burn, in that case a tattoo, that violaceous color, which is a kind of a grayish color in the black skin, occurs, and it's very itchy.
Wow. Is there a connection between lichen planus and the immune system?
Well, I guess all inflammatory conditions involve the immune system because there are T cells and other cells in the body that are involved, but not directly. In conditions where the cause isn't known, stress and other things are always said to be the cause. In that picture, you see linear lichen planus, in which a young lady just developed it on a limb, just in a straight line. These can be, as I said, the violaceous color, or in this case, you see the post-inflammatory darkening that you can get, and sometimes it can be very thick. I think there's another photo of her showing a very thick area on the other side of the arm.
That would really concern someone.
Yes, and that's the photo there. It shows the hypertrophic form because sometimes it can be very, very thick.
Okay.
And dark.
How is it related to eczema?
No, it isn't related to eczema. The only correlation is that it's very, very itchy. Another very itchy condition.
Okay. All right. How do you really take care of something like that? Because you mentioned the person could be affected for up to 2 years.
Yeah. Well, the important thing is to make the diagnosis. In these situations where you have the papillosquamous eruptions, they look so similar that sometimes even doctors have difficulty telling the difference between the various types. Once a diagnosis is made, the important thing is to really control the condition. And by controlling it, you want to keep it flat and you want to stop it from itching. So this may involve the use of corticosteroid creams or even oral corticosteroids sometimes. But the important thing is for the doctor to keep it suppressed so that you don't get it out of control.
Does this mimic any other skin problem so it can be easily confused with something else?
Well, as I said, the papillosquamous eruptions look very similar, and sometimes we mentioned something called psoriasis. We didn't mention discoid lupus, so that's another one that can look very similar. There's another one that we mentioned earlier called pityriasis rosea, so all these conditions look incredibly similar. The thing is, lichen planus can affect other areas that they can't, and like the palms can be affected with lichen planus. You can get hair loss. Inside the mouth, there's also a picture of inside the mouth where you get these light-colored areas. That's a lady who has it on the lips, and no other manifestations. So those whitish lines are called Wickham striae. That's one of the characteristics of it. But when the doctor looks at the bumps and the flat areas, they can be very shiny, and if you try to reflect a light on it, you can see that shininess.
Who is predisposed to it?
Well, usually it just occurs just out of the blue, but sometimes if you're on certain types of medications like Gold or antimalarials, it can occur. Also, very rarely if someone has a transplant, they get a reaction called the graft versus host reaction. They can have it, but most people have it just out of the blue for no reason. All age groups, from children to the elderly, it can happen to anyone.
We have a real graphic photograph of the problem occurring in the mouth. And I wanted to ask you about this because I read somewhere where if you've had maybe a fill-in or something using a metal, that it could exacerbate the problem.
Yeah, there's some individuals who only show the condition in the mouth and due to filling, so that's a lot more difficult to diagnose, and in that case the dentist has to look at the fillings and replace the fillings with some non-heavy metal.
Is this still itchy inside the mouth?
Usually inside the mouth it isn't that itchy, but the thing is you can sometimes get ulceration, and if you get the ulcerative form and you have it for a long period, then there's a risk of cancer change, something called a squamous cell cancer. But that's a very rare complication of lichen planus. Most people with lichen planus just have the cosmetic issues to deal with and the itchiness.
What about the trauma from hair weave? Doug wouldn't know about this.
Well,
can that cause it?
Well, if you have lichen planus, then certainly having a weave can predispose you to losing hair. But there's a form of lichen planus which is called frontal fibrosing alopecia, which looks a lot like the hair loss that you get from using weaves. But in this case, the inflammation occurs around the hairs that are on the frontal area, and eventually you get hair loss and also loss of some of the eyebrows. So there can be some confusion between this and the hair loss caused by weaves, and then especially in the black race, the pulling traction alopecia, pulling the hair constantly back.
Okay, all right.
This is interesting. I had a question when you sidetracked me.
Oh dear, you have to focus, Douglas.
It is difficult to focus around you, my dear.
Okay, I'll go with that then.
Why are women more susceptible to getting this condition than men?
You mean the traction alopecia?
No.
Or you mean the well, well, you take the statistics and you just see it, but I guess we don't really know why. They're just the facts, statistical facts.
Well, and what can women do to identify the problem?
Well, I think if you have an itchy condition that occurs on the limbs initially or occurs on the entire body, you should really see your doctor. You should see your general practitioner. If the general practitioner is unable to make the diagnosis,
but an itch could be a little irritation caused
you should see your dermatologist.
But if it looks like
mango milk or
but one of the characteristics is that this is very symmetrical. Unlike the young lady, that's another close-up of someone like lichen planus on the ankle. That's the violaceous color in the black skin. Okay. But it's very symmetrical usually, unless it's occurring in a line. So if you have something that's symmetrical, it's usually intrinsic, and there's something going on that isn't incidental, like something touching the skin.
Okay, so is there a fabric that you shouldn't wear if this is happening to you?
Well, any itchy condition, you should wear very light, smooth
breathable
fabrics that wouldn't have a lot of fibers sticking out, that wouldn't irritate you.
Okay.
And I want
that's a picture of something else.
Yeah, that's a picture of something else.
Okay.
Yeah, I wanted to ask you though about the kind of treatment and the period of treatment.
Well, the treatment is an interval treatment. It depends on how well the condition is being controlled. What the doctor is going to tell the patient is to give them the signs of when the condition is controlled. Okay. And when it's controlled, all the lesions are flat, but they may be discolored. But when you start seeing that violaceous or grayish color, and also if they start to thicken or you start to get bumps, or the flat areas that were or the areas that are previously flat start to thicken, then you know you have a problem. Or if in the mouth you start to get ulceration, or you start to get one of these problems. So As I said, when it's burnt out, it's just a discoloration, which is dark.
Okay, we're going to take a break, but we're going to talk about lichen striatus
Yeah.
after. And your questions are definitely welcome. You can call us at 228-5562 or 228-5563. We'll continue in a moment.
Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
Time is moving on, but we've got a lot to share with you this morning. We're continuing our conversation with Dr. Andrew Ford. He's a dermatologist. Your questions are welcome, 228-5562 or 228-5563. But today we're talking about lichen planus, and now we're moving on to lichen striatus. And this can affect children as well, Dr. Ford.
Yes, it predominantly affects children, but also it can affect adults as well. I've presented it because the first name is the same, the lichen name, but that just refers to the appearance of the bumps, which are small, flat top bumps. But lichen striatus is an inflammation that occurs in the line. Unlike lichen planus, it is not itchy, and it occurs out of the blue. Someone goes to the doctor, they see a line, they usually get a cream. That's a picture of a child with it going down the limb, the inner part of the limb. But it's asymptomatic, and they get lots of creams and lots of other things, but nothing happens. And lichen striatus tends to last for a good 9 months, and sometimes I've seen it last up to 2 years, especially if it's in the face. So it's just this very unusual line of bumps that occurs on the body.
Can we see
again,
that
for no
photograph?
reason.
Yeah,
That's
okay.
another someone's arm. You can see those lighter colored tiny bumps that are grouped together, just going about a centimeter wide.
What's a
and
parent
going
to
down
do
the
when
limb.
they see this other than panic?
Well, you're going to panic, and of course the schools worry about something that a child has
Exactly,
for
maybe
a long period.
contagious, yeah.
But education, can really free you from this panic, and that's the important thing, to get the diagnosis. But many people go around to their general practitioners, get a lot of creams that are not going to help, and become frustrated. So after a while, they end up at their dermatologist.
So is it chronic, and does it affect babies differently?
No, it affects everyone in the same way, but it is definitely chronic. The bumps just stay there and they don't change. What can happen is that it will extend, and the line will extend. It will start in one spot, and then you notice it creeps further and further along the limb. But it just stays there, and nothing happens, and then it goes away.
Is it contagious?
No, it's not contagious.
Okay.
And how do you treat it?
Again, I think this is a case where you treat the symptoms, because intervening with a steroid and other treatments doesn't do a lot. So this is something that it's best for you to wait it out and just let it go away.
Okay.
That's an interesting concept.
It's more disturbing when it's on the face.
Right.
Like let's say last week there was a young schoolboy who came, and his was going from the lower lip all the way across the jawline.
Wow.
Yeah. Or I've seen people with it coming around the eye or coming down the cheek. So it's odd looking, but the important thing is to know what it is, and I guess the parents have to answer a lot of questions from those curious onlookers out there.
Is it easy to misdiagnose?
Yeah, definitely. The thing is, as you saw earlier, there's something called linear lichen planus, where lichen planus occurs in a line. But that tends to be a lot thicker, it can become, as I said, hypertrophic, which is an extreme form of thickening, and that tends to get darker.
Right.
Lichen striatus tends to get lighter, and the bumps are lighter in color. So there are lots of things in dermatology that look similar, and there are some nuances that help you to make the distinction.
For the lichen planus, you mentioned it's mostly black people, people of our race.
Well, it can
or-
affect all races.
It can,
the thing is
okay.
that in a Caucasian, the color is
different.
much more interesting to look at. The violaceous color comes out.
Interesting, he said.
Well, it's classical. I mean, you can just look at someone and tell exactly what they have. In the black person, diagnosing skin problems is a lot more difficult because everything tends to lead to darkening. Because
Right.
we have so much pigment, melanin, that everything leads to this darker discoloration usually. So in the Caucasian, lichen planus is quite easy to diagnose. And you
Identify.
see the Wickham striae, and you see that beautiful violaceous color.
Dr. Andrew Ford, finally, I wanted to ask you, though, because you talked about the lack of education most time in diagnosing lichen striatus. Is there a program in schools where you send the information to the Ministry of Education?
Well,
or
that
to
one
the
is a
health-
very that one isn't a very common condition, but there's some conditions where things are sent to the school from the Ministry of Health, especially contagious conditions. Let's say scalp ringworm, tinea capitis is one of the main ones, and ringworm itself. Where there's a contagion and public health issue, then that's something that we really
All
need
right.
to deal with.
Let's take this caller. Good morning.
Hi, good morning.
Hi, go ahead with your question.
My son, he has what I would call a fungus in his head, and I've used like Nizoral shampoo and like Nizoral cream in his head, but it seems to be reoccurring all the time. What can I use, or what should I do, or what do I need to do to help this fungus in his hair?
Well, children under 12 tend to get fungus in the head. That's called tinea capitis. The problem is that a lot of doctors don't seem to tune into how it should be treated, and it actually has to be treated with oral treatment. So when someone gets a cream or some other thing, that doesn't work. The treatment is based on your weight, and there's a calculation that's made based on the type of antifungal you're going to use, and it has to be a long treatment that's usually about 2 months. For some of the newer antifungal oral medications, the treatment can be shorter, maybe 4 to 6 weeks. But your son isn't going to get better until he gets an oral antifungal, appropriate oral antifungal treatment for his scalp. So all these other things that the parent is doing, they are just helping to reduce spread of the condition,
Right.
but not actually treating it.
Treating it. Okay, so I hope you.
And
that
it should
means
be
you have to
treated
go.
because some unfortunate people can get a permanent hair loss from untreated tinea capitis, especially
Take
if
him
it's
to the doctor.
very inflammatory.
Yeah.
If there are bumps with inflammation, a type called carry-on, then
Right.
that can be a cosmetic emergency of
So
sorts.
she needs to take him to a dermatologist.
Yeah,
All right.
definitely.
We hope that information has helped you. We want to thank you, Dr. Ford, for introducing us to these conditions. Maybe we see it but don't understand.
Exactly.
Now we do.
Now we know what happened to Bernard.
Yeah, his hair loss. Oh dear. Well, Bernard, at least this morning you got lots of information, and we have more to share. We're going to talk to you about, as we look at preserving our heritage, this is still Heritage Month this morning. We'll have a double focus on that. Maurice Greenwich is up next. He's brought along a guest, and we're going to talk about who trains the trainer when it comes to maintaining the heritage and the information as we go. We'll be right back.